All right. Well, again, thank you, everyone, for taking time out of your busy schedules to join us on what we hope will be another very exciting webinar by the BOLD, Building Our Largest Dementia Infrastructure, Public Health Center of Excellence on Dementia Caregiving. Today, we're going to focus on a topic that has been of great interest to our center. We believe has been of great interest not only to researchers in dementia care, but certainly those of us who are providing services, who are taking the lead on developing or implementing state plans on dementia, as well as a variety of other organizational objectives. And that's really disseminating evidence-based programs to support family dementia caregivers. And today, we're really going to hone in and talk about the role of public health in these efforts, and more specifically, using this as an opportunity to launch a new toolkit that our center has developed and much credit goes to our center coordinators, particularly Alma Johnson, but Ashley Millenbaugh as well, and many others who helped develop what we hope will be a very, very useful resource. Next slide, please. I'm the director of the BOLD Public Health Center of Excellence on Dementia Caregiving. I'm Joe Gogler. My research has long focused on how can we innovatively support those who care for people living with dementia, as well as people living with dementia themselves. Next slide, please. We always like to begin our webinar with a land acknowledgement. The University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values: courage, wisdom, respect, and generosity. And I think all of you would agree, these certainly are values that can and must infuse our work in the space of dementia care. Next slide, please. Our center, briefly, I believe many of you are aware of what we do as a center and our goals and objectives, but just to remind you, the BOLD Public Health Center of Excellence on Dementia Caregiving is one of 3 national CDC-funded centers, really with the overarching objective to elevate dementia as a public health concern and imperative. Our particular center really focuses on supporting unpaid dementia caregivers. And we do that through supporting state, tribal, and local public health agencies across the country in developing their own dementia caregiving focus programs and initiatives, such as, for example, implementations of state dementia plans. We do this by improving access to evidence-based programs and best practices, which we're directly doing today. We also facilitate connections and partnerships among public health agencies, as well as many, many others in a given state, locality, and community, whether it's aging service providers, whether it is just our healthcare systems, et cetera, and really bringing people around the table to really discuss and think about how can we address supporting dementia caregivers using a public health lens. And then finally, we provide technical assistance to identify, select, and implement effective public health interventions and strategies. Next slide, please. So today, we would like you to submit your questions for the speakers into the Q&A feature in Zoom. Use chat to share comments, resources, links, and ideas. I want to emphasize to everyone that the recording and slides, as well as any resources shared, including links to our newly developed toolkit, will be shared after the event. So you'll get access to all of this. Please complete the survey at the end of this event. It'll pop up in Zoom when you leave the webinar, because we really greatly appreciate the feedback. It really helps us determine and identify future topics so that we can be responsive to your needs and concerns, and to hopefully pull together a great panel of experts like we are today to help answer your questions and help advance learning. Next slide, please. Finally, we value your feedback. Again, the survey invitation will pop up when you leave the webinar. You can scan this QR code, or of course, visit this link, bit.ly/EBP_public health. I don't expect everyone to be using your QR code or entering this in now. But again, these links and such will be shared in the chat by Elma and or Ashley throughout the event today. Next slide, please. So let's start with a poll question. In what capacity are you attending this event? And you have the following selections as you see on the slide here. So if we can administer this poll, we'll take maybe 30 seconds or so and see where people are coming from and attending with us today. Having a great response rate here. Thank you, everybody. Waiting until we get close to the participant max. Looks like we're about there. I'll give everyone 10 seconds. I will share the results shortly here. Let's go ahead and share. Everyone can see the results here on your screen. But this is wonderful, actually. We clearly have a range of attendees here. We have many bold public health agencies as well as non-bold public health agencies joining us. Community organizations and service providers are well represented. We have people living with dementia as well as their care partners, clinicians and other healthcare professionals and others. So we have a really nice diverse audience here today. Thank you, everybody. Okay, next slide, please. So again, we are very, very excited to launch this toolkit, Disseminating Evidence-Based Programs to Support Family Dementia Caregivers, the Role of Public Health. Again, this is really a guide for public health agencies, but I would argue as well as others, to build support networks and promote the dissemination of evidence-based programs for dementia caregivers. We believe really to the core of our being, and hopefully many of you do as well, that public health plays a critical role in ensuring that the support that's offered to people living with dementia and their caregivers is both coordinated and effective. And really the toolkit is designed to give and provide tips and strategies and resources to help achieve that goal and aim. Next slide, please. Why do we care about evidence-based programs? I mean, why are they so important? EBPs for short, they're effective, deployable. They are based in what one usually hopes, and usually is the case, is they're based in strong, rigorous science and research. And as importantly, they have potential to be translated. They can be implemented to those on the ground, whether it's in a healthcare system, a community organization, or other entity that can allow for adoption of these programs. So they can really meet what is a critical public health objective, that being these programs and these evidence-based programs must reach the communities they were intended to serve. Too often, and again, this could be a topic of an entire webinar itself, too often we have a very leaky implementation, translational pipeline, some call it, where ideas and science are conducted, evaluations are done, and then those programs sit on a shelf in a journal. They never are adapted and translated into the field. Organizations such as the Administration on Community Living, and we're so happy to have Aaron Long with us today, have gone to great lengths and have really helped to expedite that leaky pipeline, but there's much work to do. And we would think that public health can play a role in, again, getting the best possible evidence-based programs into the field so they can reach as many people as they were intended to. Next slide, please. You see here the seven actions that can promote evidence-based programs for family dementia caregivers. Again, this is part of our toolkit. You see the seven here, and I don't think I'll go through these in detail for the interest of time, but if you consider these seven actions, you'll notice that many of them involve to some degree or capacity evidence-based programs. Conducting a landscape assessment, who is actually doing what in a given community, and are these actions actually based or steeped in some type of evidence? Clearly promoting programs and facilitating referrals. One ideally would like to promote programs that are evidence-based. Clearly 3 is directly linked to what we're talking about today, promoting those best practices. Often to deliver an effective intervention, and quite frankly, to sustain it, it requires partnerships. So what are the partnerships out there to identify incentivization, funding, other types of key actions that are often necessary to not just adopt a program, but to sustain it. And I think many of us grapple with the whole issue of sustainability. And then you see some of these other actions as well. Next slide, please. You know, before I turn it over to our very distinguished panel of speakers here today, I mean, one point I want to emphasize before I turn off my camera and stop talking is I really would argue we're in a very exciting era when we think about supporting dementia caregivers from an evidence-based perspective and a public health perspective. I think many of you are aware of the GUIDE model. which has just launched this month. The Centers for Medicare and Medicaid Services just announced the support of roughly 400 healthcare providers across the U.S. to provide what is essentially an expanded collaborative model of dementia care based on science and evidence. And as part of that model, a core element is the incorporation of care partners into care planning, but then also providing direct support to those care partners, whether it be respite, education, training, or support groups. And it's in these areas of caregiving support where one would hope and where we all can play a role to ensure that guide models are indeed delivering services and supports to dementia caregivers that in fact are evidence-based. And with that, I'm going to turn it over to our panel, and you will hear more about tools and resources that can help us achieve that goal. We have two experts here from the Benjamin Rose Institute on Aging. And I think for most of you may know, but if you don't, Benjamin Rose BRI has played a leading role in developing the best practice caregiving websites, both for healthcare professionals and caregivers themselves, that really has taken the scientific literature and created a very palatable, usable online resource that, again, providers or caregivers can use to help make that decision about what is the right evidence-based program for us, our community, the people we serve, that would likely be most effective and most sustainable and most feasible. And you're going to hear about those resources from Rachel Cannon and Dr. Morgan Mignon. And then finally, as I had mentioned, and again, we must really thank Erin Long for all of her long-term efforts as the Aging Service Program Coordinator and then team lead of the Alzheimer's Disease Programs Initiative from the Administration for Community Living. Again, Erin and her team have done probably as much as anyone in trying to, again, bridge this translational gap, get evidence-based programs into the community and trying to assist and help programs not only adopt these programs successfully, and help them remain sustainable. And we'll be hearing from Erin and all of her efforts and the resources ACL offers to all of us as well. Thank you, everyone. And I'm going to turn it over to Rachel.
Thank you, Dr. Gogler. And I want to thank the Public Health Center of Excellence on Dementia Caregiving for inviting us to be a part of this webinar today. We really appreciate the opportunity to speak with you all. So I'm Morgan Mignon. I'm a research scientist at Benjamin Rose Institute on Aging. And today my colleague Rachel Cannon and I are going to give you an overview and demo of the newly launched public version of Best Programs for Caregiving that Dr. Gogler started to mention. So next slide, please. So as you did kind of hear a little bit of an intro with Dr. Gogler's opening presentation and maybe have experienced in your own lines of work, but it can be a challenge for many service organizations to find and learn about the evidence-based caregiver support programs that are available, especially finding the detailed information about these support programs and knowing which program would be a good fit for your organization specifically, and if the program can help address the needs of the caregivers that you are serving in your communities. On the flip side of that, family and friend caregivers also struggle to find information about these proven support programs. Many of them do not know these programs exist, and if they do, it still can be difficult to find organizations that offer a support program. Next slide. So this lack of a comprehensive, updated source of information on evidence-based programs was really the driving force for the development and launch of the professional version of Best Programs for Caregiving back in 2020. And this launched as a free online national directory of vetted programs that support family and friend caregivers of people living with dementia. And the 45 evidence-based programs included in this directory have demonstrated beneficial outcomes for caregivers in published peer-reviewed research articles. And these programs have also been delivered to caregivers in at least one non-research, real-world healthcare or community-based implementation. So as it can be inferred by the name, this first version of Best Programs for Caregiving was really designed for professionals as well as funders and policymakers to help discover and share high quality programs for caregivers. And each one of the programs in the directory has a comprehensive profile, which provides you some of that detailed program information and some information about the focus of the program, the different characteristics, maybe whether it's delivered in person or if it has a virtual component delivered over the phone or online, as well as experiences of the delivery organizations that have offered the program. And all of this information is designed to help providers who are looking to select a program find one that fits well with their organization, and again, specifically with the caregivers in the community that they are serving. So soon after the launch of the professional version, we conducted an evaluation of the website users and found actually that family and friend caregivers were using best programs for caregiving as well. So our team decided that it was really time and there was a need to move forward with a public version of this online resource. So this new public version of best programs for caregiving just launched in April of this year. And it's a first of its kind free directory designed for family and friend caregivers. And this public version has information on over 200 healthcare and community organizations that are delivering one or more of the 45 evidence-based programs included on the professional side of the website. So when you're using the resource to find these organizations, caregivers simply enter their zip code to find those high quality education and support programs that are offered in their area, whether that be online or by telephone or in person. And currently, there are 18 different evidence-based programs that are offered remotely in this directory nationally. And so that means that no matter the zip code that's entered into the search feature on the website, there is a support program being delivered by a service organization available to caregivers in every zip code, which is a really important feature and a resource out there for especially reaching rural and underserved communities. Besides the program features and focus areas, a lot of the other aspects we included on this new public version can help caregivers find information specifically on maybe the program or organization's eligibility criteria and requirements, learning about how they can enroll in the program, any costs associated, the length or the format of the program, all of this information, as well as a section on how organizations have adapted or translated the program to serve caregivers of diverse communities. Next slide, please. So with that, I'm actually going to pass it now to my colleague, Rachel Cannon, and she's going to do a live demo of the new public version of Best Programs for Caregiving. That way you can really get a feel for how to navigate the online directory and all of the information that's provided.
Thanks, Morgan. Hi, everyone. I'm Rachel Cannon. I'm a senior research analyst at Benjamin Rose Institute on Aging. So on our homepage here at bpc.caregiver.org, you can access both versions of BPC. So here you can access the version for professionals, really to help them find programs that are available to implement in their communities to caregivers. And you can also access the new public version that Morgan just talked about by clicking on I Care for Someone with Dementia. So I am going to do a walkthrough of the professional version at the end of the demo, but wanted to focus first on a walkthrough of the new version. So again, this version is for family and friend caregivers of individuals living with dementia to use to find evidence-based programs that are available to them in their communities. So it really can be used directly by family and friend caregivers, but also could be used by other family member or friends or even professionals searching on behalf of caregivers for these programs. So by clicking on I Care for Someone with Dementia, this is going to take you to the search page. And as Morgan mentioned, this is a zip code search. So caregivers can enter their zip code, but they could also try, just a tip here for long distance caregivers, entering the zip code of the person they care for by clicking on View Programs. This is going to give you a list of all of the programs that are available to caregivers in that zip code. So the zip code search is based on service area of the organizations that are delivering programs. and not by the actual physical address of the organization. So that really means that programs that are in person, locally available to that caregiver are going to show up, but also there may be some programs that are offered online, maybe from an organization out of state or further away, is going to show up as well. So both, in person and online programs will show up in that zip code search. As you can see, each listing has the program name, the organizations that delivers it, just a brief description of the program, and the different modes of delivery. And you'll also have this button here to learn more. But I do just want to scroll down and show everyone the different programs that are available. You can see there's a long list of different programs, different types of programs, and different modes of delivery. But just scrolling back up to the top here, we do have this filter programs bar. So for an example, you may be looking for programs available online. You can use that filter bar, and that's going to pull up all of the programs that are available with an online component. By clicking on the Learn More button under a specific program, you're going to come to the more comprehensive program profile page. Again, you can see the program name, a brief description, and some different types of help that the program provides. You can also get more information about the organization that's delivering the program, the physical address of the organization, and the general contact information. You will also find if there is a cost to participate in the program for caregivers, and if so, if there's any payment options available to them. Any eligibility requirements will be listed here as well in order for the caregiver to enroll. You'll find all the information needed to enroll in that program, whether it's a phone number, website, or email. You'll also be able to see the service region of the organization. So the specific organization you can see delivers this program in these counties in Florida. And then you'll get some additional program details. So again, those different modes of delivery, some information about the program length and sessions, who the program's led by. And you can also link back to the professional version, again, which I'll do a demo here in a minute, but this will really just give you some additional information on the program if you're looking to get a little bit more information about the types of assistance the program provides, or more information on the research that's been done about the program. That link will take you back to that professional side. And as Morgan mentioned, we wanted to focus in more on the different diverse communities that have been served by programs. So you'll be able to see here whether the program is being offered in any other languages other than English to caregivers by this specific organization, and the different diverse communities that have been served. So you can see here in this table, you'll see the different communities that have been served by this organization with this program, and some different ways on the side here that these communities have been served. Scrolling back up to the top, I can return to search. And this is going to take me back to that initial list. I do want to just go through another example here quick. By clicking on Learn More, again, you'll see the Savvy Caregiver program being delivered by an area agency on aging. You'll get that types of help that the program provides, cost and payment options, again, how to enroll in the service region, and some program details. So just another example of a program available to caregivers in that zip code. So if I go back to our home page here, I do want to do just a quick walkthrough of the professional version. You can access this by clicking on I am a program provider. This is going to take you to the professional version homepage. So here you can learn a little bit more information about what information is included in the professional resource, how to use the database, learn more about our funders and our partners in sustainability, and more about the project, as well as some additional resources down here FAQs, more about the inclusion methodology of the programs, and how to contact us. But really at the top here, by clicking on click here for programs, this is going to take you to the search page. And you'll initially get a list of all of the programs that are included in BPC with just a brief description of each. And this is in alphabetical order. A couple different ways to filter. You can use this filter bar up top, but you can also see on the side we have several other filters that really just includes different program components, such as languages that the program can be offered in, modes of delivery, types of assistance, as well as some of the different study findings or outcomes for caregivers and individuals living with dementia. So just as an example, if you were looking for a program that could be offered in Spanish, meaning the materials of the program are available in Spanish, and a program that might be available online or web-based, you can see that filters down to 14 different programs. Again, you'll get the program name and a brief description. This version of Best Programs for Caregiving also has a compare feature you can see on the side. You can compare up to 3 programs at a time. So if I scroll through and just click on 3 and click compare now, this is going to bring up those 3 programs with some detailed information below that you can compare side by side. So again, looking at some different target populations of the program, any program costs or fees, some different program components, so the different modes of delivery or format. You can also find some information about the different staffing needed to deliver the program, as well as training that's provided for the program. You can also compare some information that we collected from organizations that were delivering the programs and their experiences with delivery. As well as at the bottom, you can compare the different research evidence across the 3 programs. So a lot of information to compare under the compare feature. By clicking on See Program, you can then go to the comprehensive program profile page for that specific program. So you can see here, there's a ton of different information about the program, even in more detail than on the compare feature. So again, those program costs, some different program features. There's a table of the different types of assistance that the program provides and who it's provided to, as well as some additional information on the survey of delivery sites that we did. So you can take a look at the different experiences of organizations that have delivered these programs. I won't go through all of this. There's quite a bit of information here, but just to give you an example. And then at the bottom, again, you can look at that different research evidence. So what outcomes were tested and found to be beneficial for caregivers and for individuals living with dementia in research studies, and more about those studies. At the top, we do have a list of the program articles as well. So this is all of the research articles that have been published, and a link to where you can find those articles if you want to learn more. And then contact information for the developers and what those contacts provide, and really just how to access the program. So yeah, that is a walkthrough of both versions of Best Programs for Caregiving. If we could go back to the slides. Yeah, so we just asked that if you could please help us share this resource with caregivers, whether it be directly sharing the link at bpc.caregiver.org. We will also share with you all in the chat a link to our promotion toolkit. So this toolkit is really to help with sharing this resource and different ways that you can share it. Next slide, please. And then I know we're doing a Q&A at the end of this session, but if you do have additional questions or would like any more information, please contact us at bass.onlineresource@benrose.org. And now I will pass over to Erin.
Thank you so much. I too want to thank the Center for Evidence-Based Center for Excellence for inviting me to join you to talk about what ACL is doing in terms of disseminating evidence-based and evidence-informed programs to support people living with dementia and their caregivers. So next slide. Just for a little context, I just want to tell you about the program that I lead at the Administration for Community Living, which is a operating division within the U.S. Department of Health and Human Services. I actually work for what's called the Administration on Aging. And for a very long time, we have been supporting programs across the nation we've been funding programs across the nation to support people living with dementia and their caregivers. At this time, our program is called the Alzheimer's Disease Programs Initiative, and we have some core components of our programs. We are funding grants to state, community, and tribal entities. The program is designed to expand dementia capability of states, communities, and tribes through a single program. We've been doing, in 1992, we started offering grants to states. Then in 2014, with the Affordable Care Act, we began to make funds available to communities and tribes. And then in 2018, we combined those two programs into one. So through our programs, we deliver dementia-specific evidence-based and evidence-informed interventions to support people living with dementia and caregivers, all with the intent of improving and expanding on strengths-based, person-centered care for people living with dementia and caregivers. And through this, we are able to support paid and unpaid caregivers through the provision of education, training, and tools. I'm not going to go into the other two programs that we fund through ADPI, but we do fund a new program through the Alzheimer's Association called the Community Innovations in Dementia-Specific Respite. You may have seen information on it. The Alzheimer's Association is the grantee, and they created the Center for Dementia Respite Innovation. And we also fund a quarter of the budget for the National Alzheimer's Call Center. So next slide, just to give you a sense of the breadth and depth of what ACL has been funding. I just wanted to sort of throw out this slide that shows the diverse communities that we've served and the cultural communities, as well as other populations that we're serving across the nation, and the expanse of the states that we're covering. So next slide. But I'm really here to talk about our resource that we've had for a number of years, but we update it fairly regularly, and we actually just updated it in July. It's our grantee implemented evidence-based and evidence-informed interventions compendium. So this is a picture of the cover, but there's two links. The top link on the right is to actually get to that space on our website to get to the document, and then the link below is to actually just get to our National Alzheimer's and Dementia Resource Center that has a tremendous number of other resources related to serving people living with dementia and caregivers. So now I'm just going to sort of dive in and tell you all about what we have. So next slide. It's important to know, so for ACL's purposes, in our grant program, we require that every single grantee implement an evidence-based or an evidence-informed dementia-specific intervention. We allow our grantees to determine what the audience is that they're serving, but we do ask that they implement interventions that meet our definitions of evidence-based and evidence-informed. So I'm just going to literally read it. Our evidence-based definition is effective in improving, maintaining, or slowing the decline of the health and functional status or functional status of people living with dementia or family caregivers, suitable for deployment through community-based human service organizations, and involve non-clinical workers and or volunteers of delivery of the intervention. It has research results that have been published in a peer-reviewed scientific journal, and the intervention has actually been translated into practices and ready for distribution through community-based human service organizations. That sort of goes to the thing that Dr. Gagler mentioned earlier in terms of interventions that the research has been done and then it lands on the shelf. Where our goal is to get things off the shelf and into the communities. Our definition of evidence informed is a little bit more specific in terms of what we will fund. It must have substantive research evidence that demonstrates an ability to improve, maintain, or slow the decline in health and functional status of people living with dementia or caregivers, but it must have been tested in at least one quasi-experimental design or comparison group with at least 50 participants, or it is one of those evidence-based interventions that's being modified in a specific way or adapted, translated from a single evidence-based intervention to changing it a little bit to meet the needs of the community. Sometimes it has to do with bringing cultural competence to a certain audience. Sometimes it is taking it from one setting. If the research was done in a skilled nursing facility, but you're trying to bring it to a community and the adaptations that you have to make to take that evidence-based intervention, the components with as much fidelity as possible, and just changing one little specific aspect of it to bring it to the community. Next slide, please. So we have a lot of the same information that Best Programs for Caregiving has. The difference is ours is not a database, but rather we just have a compendium document that has over time, we've been doing this, like I said, for many years. Over time, we've been collecting the information. If people choose an intervention to implement it through our program, those are the only programs that are included in this compendium. This is not a document that's saying, you know, these are the only things that we fund. It evolves as time as our applicants and grantees choose what their community needs. But this is just one intervention. It's really small font, so I know you can't read that, but if you look up the document, I just want to give you a sense of what it would look like. But there's a ton of information there. We talk about the intervention itself. Who's it targeting? We give information on the original study. And there's a list of, so we talk about in the table itself, we talk about the original study, but then in the rear, in the Appendix C, we actually, many of our grantees, after they implement an intervention, they too will publish on it and show their impact and their outcomes. And so we also include the links to additional studies in the back of in the appendix. It has a description, a brief description of the intervention, how it's delivered, the length and the session lengths, and then the program lengths. So if it's 60 minutes for once a week for 6 weeks or something like that, that information is there as well. There's also information very important information on licensing and materials, where the website program details where you can go to find out about the licensing requirements. What kind of training is necessary to be able to deliver? What are the materials, and really what are the costs? What are the immediate costs, and then what could be some of the long-term costs? And then a very important part that we have is the grantees that are currently implementing whatever the intervention is that you're looking at. So this is the snapshot of one intervention. I would say that we do, as I noted before, we have the evidence-based interventions and the evidence-informed interventions. We actually have profiled 17 interventions that are evidence-based in this compendium. And then we have 18 interventions that are evidence-informed. So, and we have the same information for both evidence-based and evidence-informed. Next slide, please. So that's sort of the snapshot of what is the core of our grantee implemented document. But one thing that that's really important that I like to point out, and that's part of this document, is the Appendix A. What we've learned over time is that the decision to choose your intervention is, there are many critical questions you must ask yourself before you make the decision to deliver an intervention. So we created a choosing an evidence-based or evidence-informed intervention sort of a decision-making document. And it includes the questions, the topics that people should consider before choosing an intervention to bring it to your community. And it emphasizes the importance of making informed decisions. Surprisingly enough, we found on numerous occasions that the organizations that applied for funding from us and to do interventions, they didn't ask the community, they didn't engage the community. At the core of everything we do, community engagement, stakeholders, engagement is at the center of everything you do in terms of like bringing something to your community that they're willing to receive from you. But this considerations document talks about readiness and the characteristics of a program, so that that it gives you questions, so that when you call a organization that's going to sell you their product, essentially, it gives you the kinds of questions you need to ask them. What does it cost for licensing? What is it training? They're asking you to pay for technical assistance. What does the technical assistance entail? Do you need to, purchase a online platform? How are people sustaining it? The questions you need to ask yourselves about the ways in which, if you bring something to the community, how will you keep it going after you've determined that it's something that your community embraces and is willing to receive. It's sometimes easy to find the money to bring something, but you really need to get that information. You better be able to demonstrate your impact so that you can sustain it. The reason we focus on evidence-based interventions is because the funding through my agency comes through the Older Americans Act, and there are some vehicles through the Older Americans Act from which an evidence-based intervention might be able to be sustained. So that's a very important consideration about how your organization is funded and how you might be able to continue to keep something going after your initial launching of it. Next slide, please. So that's really a quick snapshot of what we have created at ACL, and we continue to, every year we get new grantees, new interventions are coming all the time and being introduced to us into our programs, and then they sort of take off. We are also home to the National Alzheimer's and Dementia Resource Center. If you're not familiar with it, I would strongly encourage you to take a look. There are numerous resources there in a broad range of languages. I was just looking at it the other day, and we have, Russian, Chinese, Japanese, Tagalog. I mean, just so many, Spanish, obviously, so many resources in different languages and that everyone can benefit from. I would just encourage you to check there and see if there's resources that can help you deliver programs to people living with dementia and caregivers, but also just free resources that taxpayer dollars paid for, and we make available to you for free because your taxpayer dollars paid for them. And next slide, please. So I just wanted to the couple of things that I talked about, I just wanted to give links to those to the compendium, the grantee implemented evidence-based and evidence-informed interventions. I also included the link to the choosing evidence-based, the decision makings, the considerations document. That's actually included in the compendium, the grantee implemented, but we also have it separately as it's, one's not exclusive of the other. And again, just those translations, all the great resources that are available on the NADRC website, and tons of resources about bringing cultural competence to your programs to be able to serve the broad range of communities in the melting pot that we serve. And with that, I will just say thank you and turn it back to the Center of Excellence folks.
Hi, everybody. We have been having a quite robust conversation here on both the Q&A as well as the chat. I've certainly been answering things, and I think our panelists have too. I think what we would like to do here now is go through the remaining Q&A, the questions in the Q&A box, and to have our panelists answer them, and I'll certainly weigh in as well. So I'm going to start. We have a question here from Claire Lou. And I believe this will be for Rachel and Morgan. Is there a way to filter for in-person resources exclusively? I believe on best practice caregiving. That's the question we have here.
Sure, I can answer that. So on the public version for caregivers, we do have that that filter bar that I demonstrated. Really, that's the only way now to be able to filter for those in-person between online and in-person programs. So you can use that filter bar by typing in person. That'll bring up the different in-person programs that are available. And then you will want to look at the detailed information for a specific program as well, because that will give you, if there's any other eligibility criteria or specific service area restrictions that will be under the detailed program information.
Okay, thank you so much. Aaron, I'm going to have you answer this one live. This is from Mary Ann Sterling. Most caregivers that I know, and I think you've kind of addressed this, but most caregivers that I know want assurances that any programs they seek out have been created and or vetted by actual dementia family caregivers with real experience. How can they sort through these lists and the question here was the BPC programs with this parameter? But I think in general, we probably want to consider this not just for best practice caregiving, but overall when we consider evidence-based programs. So Aaron, I'd like to hear what your thoughts are on this.
So in the research, the interventions are tested with people living with dementia and their caregivers. I would say that would be my core answer, that the interventions, the impact of those interventions is tested with the research. But I would say it for both, I'm not going to try and speak for the BPC, but when we put things in our compendium, it's because people have been doing it in the community, and we actually, so our resources is really for the organization that's looking to serve their community, and we provide the names of the organizations that are actually delivering those to people living with dementia and their caregivers, and they would, you can contact them to find out, but I would say inherently by being on either of our lists, that means that they are tested and embraced by caregivers and people living with dementia. I don't know if the BPC folks would want to add to that.
Yeah, I'll echo what Aaron said, in that part of the criteria for being a best programs for caregiving program on our website is that you have done a real world implementation within a healthcare or community-based organization outside of a research study or context. So these are programs that have been offered to caregivers living in the community. And then the other thing that I'll say too is on the new public version that Rachel demoed, if you scrolled down to the bottom, and specifically for diverse communities that are served, one of the pieces of information that is in that matrix is whether or not people who are from that community were included in either the development or adaptation that was made specifically to that program for that caregiving community. And so you can see also a little bit of more detailed information about that on the public version as well.
Okay, great, thank you. So I'm gonna, both Morgan and Rachel, I'll have you answer this. Does any of this include the benefits to the person living with dementia, not just the family care partner?
Yeah, so again, criteria related to our database and our directory specifically is that the program has to show a beneficial outcome for the caregiver. However, many of these programs do have beneficial outcomes that have been identified in those research studies for people living with dementia. And the ways that the program helps both the caregiver and the person is something that is information that's provided on the professional side of the website when you dive a little bit deeper into each program. And down actually at the very bottom in the research outcomes section, again, of the professional side, it'll show you the different contexts and where both caregivers and people living with dementia were benefited from the program. So that could be across different well-being outcomes or maybe different types of service utilization. So the program helped both caregivers and the person living with dementia use additional support services, those types of things. So the professional side does provide some of that information, and it's program by program on if the person with dementia has been shown to be beneficially impacted.
Yeah. There is an interesting sidebar happening in the chats I think are important for us to consider too. So Marianne Sterling has a suggestion. Family caregivers don't just need to be studied, but are actually guiding the research and programs, and several others have mentioned how much they like this idea. And, I couldn't agree more. Is, much of the traditional evidence, this is an interesting conversation. This is more my, I guess, soapbox here. Often we think of this whole idea of evidence-based programs in a very linear, unidirectional way, right? Where, you do the science, often it is done, as Mary Ann suggests, likely maybe not in concert or with active engagement with caregivers, or quite frankly, people living with dementia too. These studies are done, a trial may emerge from that, and then we start thinking about how we can actually implement it successfully in the field. And that's been, I think, the traditional model. It's become very evident that that's not a very efficient model. If one does not incorporate the viewpoints, if one does not engage actively with care partners, with people living with dementia in the design process itself, it often will lead to an end program that might not have a whole lot of sustainability potential, may not be easily implemented in a given community, organization, healthcare system, in part because it's not really focusing on what's important to the people who are going to be the end beneficiaries of it, at least presumably. So yeah, this idea of, applying in the research is called community-based participatory research approaches and methods. But this idea of co-creation of programs and innovations is one that I would argue has been somewhat late to come to the dementia care space, but could have a lot of value in this space as well. And one more point about that, Mary Ann and others, that are here, one thing that's really important is it's not co-creation of programs is important. You know what else is really important? We find this out with our own research. When I do trials and sometimes they're not effective, I mean that they're usually shown not to be effective based on some measure, some validated measure in the field that people think should be done because it's been validated. So since everyone else has used it, we'll use this measure of depression or this measure of stress or whatnot. And so sometimes we get very disappointing empirical results suggesting that our program doesn't work. It's not evidence-based. It's not evidence-informed, anything like that. But then when you start getting more open-ended information from caregivers and others, qualitative data through interviews, focus groups, open-ended items, whatever, you start to get a sense that in fact, the program did work for families. And so when you think of co-creation with caregivers, in addition to the program, it really should also be focused on the outcome. How do you measure something that actually matters to the people using the program? You could make a very strong case when you think of how programs like these are incentivized, how they're sustained, et cetera. A big problem has been when we're demonstrating effectiveness, are we actually using the right measures to capture whether they're working or not? Sometimes these programs are very person-centered, they're very flexible, they're very tailored, and then you administer this really static measure that doesn't capture what the program is doing. So that's
So
another great opportunity for
I want to chime in
co-creation.
here too.
Yeah,
I
please.
apologize. I thought you were finished before I opened my mouth.
No,
But-
Aaron, go ahead. I shouldn't have gone on my soapbox.
No. It's super important, but I want to stress, we are not doing research, and I don't think the people at BPC are doing research either. We're taking the things that the researchers have already done their thing, and they've gotten, they've worked more so now than in the past. They've included caregivers and people living with dementia in their research. They're getting much better at it.
Yeah.
What I want to chime in on is that part about like not going back to the research tools to find out about the impact that it's having on the community and focusing on the impact on the community. Not that the research was great and we're going to revalidate the research. We need to focus using person-centered, strengths-based outcomes, impact outcomes tools. I am so tired of people coming to me and saying, well, we're going to say that it helps caregivers not have burden, and everything focuses on people's deficits.
That's a good point. Yes.
To go in for people's strengths, whether it's the strengths of the caregivers or the strengths of the people living with dementia, and really hone in on the impact. With our programs, every grantee has to test for the work that they're doing to demonstrate the impact on the quality of life of the people living with dementia.
Right.
I don't care if you're serving caregivers or people with dementia.
But but my argument is this: you're absolutely. There's nothing I disagree with what you said, Aaron. My point is, for those of us that are researchers, and I do believe, in addition to research informing practice, practice can inform research in this regard. And the way I see that is when we actually decide to create some new innovation, that we do adopt person-centered outcomes alongside person-centered programs, if that makes sense. And if we do that earlier, I would argue that we're going to end up with programs that in fact have much greater sustainability and implementation potential than traditionally how the field has evolved up to this point. And I think you would agree with that, Aaron, and Morgan and Rachel as well.
For sure.
One final, go ahead. Any other final comments from our panelists here, as we have a few minutes left?
I was just going to kind of echo in on that conversation and just mention that there's a lot of different ways that, as Aaron mentioned, these are programs that have been previously tested in research, and the purpose of these different resources is really to help get that information out to the people who would benefit from it. But when we, to your point, Dr. Gogler, when we look back at how can all of that research, how can all of kind of the everyday use now of these programs inform additional research, and where we've come a long way. We have these programs that are very helpful to people and that are now getting into the hands of actually caregivers and people living with dementia, but that doesn't mean it's the end point. There's a lot of work that still needs to be done. And I think these conversations that we're drawing on today and the things that people are mentioning in the chat is that they're addressing those gaps. They're saying, they're identifying different ways in which we have these programs, but how can we improve upon them? And one of those aspects is looking at those types of assistance that caregivers are really hoping a program can provide them. And to the points that have been made, making sure that these programs are being tested with those outcomes in mind and being developed with those outcomes in mind, so that we can really provide caregivers the type of support that they're looking for.
We are rapidly running out of time here. I mean, there are a lot more things we could cover, and looking just at the chat as well as the Q&A. I think I'm going to conclude with a final question to Aaron. Aaron, if I want to speak with a past implementer of an evidence-based program listed in Appendix B, how can I get the appropriate contact person's name and information?
Well, there's two ways to do it. You can email me and I can get that for you. Or there is on ACL's NADRC website, we actually have the profiles of every grantee that we funded in the last 10 years or so. And in those documents, if it says, Amazing Place did it in 2015, you just look up the 2015 profile. It gives you the name, it gives you the phone number, the email of the person that was responsible for the grant program. But I can certainly give you contact information of people if you have something specific.
Great. With that, everyone, I think we will conclude our webinar. Thank you, Aaron, Morgan, and Rachel. Again, great conversation, great information presented. As a final reminder, everyone, please do take a moment to complete our survey vis-a-vis the QR code, web link, as well as what will display on your Zoom when you leave. Thank you, everyone. Obviously, this is a topic that requires ongoing conversation and thought. We'll continue doing that. And we so appreciate the great questions and comments here today from all the attendees. Thanks, everyone. Have a great rest of your day.